orders.
Ebola cases are surging in Central Africa, and health leaders say this outbreak is moving fast. At least 131 people have died, with 531 suspected infections. An American missionary in the Democratic Republic of Congo has also tested positive. And experts warn this rare strain has no approved vaccine or treatment, and test kits are limited. So joining me right now is Dr. Natasha Bhuyan with One Medical. This is really interesting.
Yeah.
The WHO, World Health Organization, has declared this outbreak a public health emergency.
Right.
Explain what Ebola is and the symptoms.
Yeah, so Ebola is an infectious disease and it causes hemorrhagic fever. The Ebola virus starts off like many other viruses. People have fatigue, they have fever, headaches, body aches, and then it quickly evolves into vomiting, diarrhea, weakness. And what we do see is that the virus actually affects the cells of our blood vessels. And so then blood ends up going into tissue. It can cause multi-organ failure, and that's why Ebola is so deadly.
Okay, so how is it spread?
You know, it spreads from contact with bodily fluids. And so when people come into contact with saliva or blood, this is actually why we see healthcare workers are often sick, because they're drawing blood, they are taking care of contaminated bed sheets. Now, the thing to note is that it's not airborne. So it doesn't spread like COVID or measles. It truly is contact with bodily fluids. But the other thing that's important to note is that people are contagious when they show infection, when they show symptoms, but then they're still contagious even after the symptoms resolve.
Oh.
And so there's cases of people who they've got infected, they've had it for a few weeks, they resolve, but then weeks after, they have blood and saliva that can still contaminate others. And that's why it's so dangerous, because it can spread so quickly.
Okay, so we had said before that there's no vaccine or treatment. So what do you do?
Well, really, early intervention is key. And so we want to make sure that we diagnose people early. And oftentimes people get sick because they're losing fluids. And so make sure that they get IV fluids, electrolyte replacement if they need oxygen. And sometimes we'll give people antibiotics for secondary infections. Now, there is a vaccine and there is treatment for other Ebola strains, but this particular strain, it's the Bundibugyo strain, it doesn't have a vaccine or treatment, so it's really supportive care.
You know, hantavirus, it's been in the news so much with the cruise ship and everything like that. How is hantavirus different from Ebola?
Yeah, so the hantavirus strain that we're seeing, it actually affects the respiratory system. So it causes pulmonary syndrome, whereas this Ebola ends up causing hemorrhagic fever. So it is different in how it evolves. And then hantavirus is less fatal than Ebola. With Ebola, we see 50 to 90% of people that are infected can die from it.
Whoa.
And so Ebola is very concerning.
Okay, which is very disturbing. So bottom line, how concerned should we be?
Well, really, this Ebola outbreak right now, it's very concerning for the people in the region, so the people in Uganda and the DRC. But the risk to the general American public, it's still low. You know, right now it's contained in terms of travel. I do anticipate over the next few weeks we're going to see a lot more cases, but we've just got to be vigilant about travel. Likely we'll see people infected who are serving serving over there from the US. So right now there's a doctor who's infected, but at least we're able to identify those people, quarantine them, and get them treatment. But we definitely need to be vigilant over the next few weeks.
Well, and when you talk about travel, I mean, we've got summer travel, we've got, the World Cup coming up. I mean, that's a little concerning.
Yeah, it is concerning, but I think as long as we're vigilant, as long as we're monitoring people, there's a lot of public health interventions to make sure people aren't traveling with symptoms. But for anyone that's planning on traveling, make sure to keep an eye on the CDC, because there's a lot of advisories.
Okay, great to have you. Always good analysis, Natasha.
Thanks so much.
Troy.
Yeah, good information.